Good morning. Today I'm going to be talking about my research topic, equine-assisted therapy, and how it plays an important role in improving mental health treatment. The main purpose of my research is to show that equine-assisted therapy is an effective complement to traditional therapy. While traditional therapy is still important, it does not work equally well for everyone, especially for people who struggle with communication, trauma, and emotional regulation. Equine-assisted therapy helps fill those gaps by offering a more interactive and non-verbal treatment. To begin, one of my main points is that traditional therapy has limitations. Most confidential therapy relies heavily on verbal communication between a patient and a therapist. While this works for many people, it can be difficult for individuals who experience trauma, have developmental disorders, or struggle to express their emotions because of this. Some people are not able to fully benefit from traditional therapy alone. This leads into my second point, which is how equine-assisted therapy works differently. Instead of focusing on talking, it focuses on interaction with horses. Horses are highly intuitive animals that respond to human emotions without judgment. This creates a safe environment where individuals can build trust, improve emotional awareness, and develop confidence. Research shows that people involved in equine therapy often experience better emotional control, higher self-esteem, and reduced anxiety. Another important point is the wide range of people who benefit from this therapy. For example, individuals with autism have shown improvement in social and communication disorders through equine therapy. Teenagers with eating disorders have reported feeling calmer and less judged. Veterans with PTSD have experienced reduced stress and anxiety. Even individuals with physical conditions like multiple sclerosis have seen improvements in balance and overall quality of life. My research also highlights the consequences of relying on traditional therapy without alternative options. Many individuals may continue to struggle with emotional distress, slow recovery, and relapse. This not only affects the individual but also their family and society through increased stress and reduced quality of life. This shows why expanding treatment options is so important. Now, looking at the opposition, some people argue that equine-assisted therapy should not be used because it can be different to standardized and may be consensually effective as traditional therapy. They believe it should not replace clinical treatment. While the concern is valid, my research shows that equine therapy is not meant to replace traditional therapy, but rather to support it. Studies suggest that it is most effective when used alongside conventional methods. So instead of viewing it as a replacement, it should be seen as an additional tool that can improve overall treatment outcomes. In conclusion, equine-assisted therapy is a valuable and effective approach that addresses many of the gaps found